Hello, my name is Dr. Bethany Wong and I work at the Stop HF Clinic in St Michael's Hospital, Dublin. Today I'm going to be talking to you about what puts us at risk of developing heart failure. We refer to conditions that increase the chances of developing a problem as risk factors. Risk factors for heart failure can be divided into those that we can control and those we can't. The two main risk factors that we don't have control over are age and genetics. As we get older, the risk of developing heart failure increases. Our genetic makeup can also determine our risk of developing heart failure, but we don't clearly understand how our genes fully affect our risk just yet. The risk factors that we do have control over are most important, as we have an opportunity to change them and reduce our risk. The most common risk factors that we can control through healthy behaviours are high blood pressure, diabetes mellitus, cholesterol, being overweight and alcohol intake. The risk of heart failure is reduced by all of the above, as well as avoiding cigarettes. High blood pressure, also known as hypertension. High blood pressure is a common condition affecting over 20% of the adult population. If your blood pressure is high, your heart has to work extra hard to pump blood around the body. Over time, this can produce a strain on the heart and increase your risk of heart failure. It is therefore a good idea to have your blood pressure checked at least once a year at your GP or pharmacy. Often the cause of high blood pressure is not known, but what we do know is that staying active, maintaining a healthy weight, and minimising salt and alcohol intake all reduce your chances of developing high blood pressure. Finally, if you have been prescribed a blood pressure tablet, taking this will help to reduce your risk of developing heart failure by helping to control your blood pressure. Diabetes mellitus. This is another common condition affecting around 6 to 8% of all adults. Lifestyle behaviours play a big role in our risk of developing diabetes, especially being overweight and inactive. Diabetes puts a strain on your heart in many different ways, and therefore effectively managing diabetes is very important. Weight management and exercise reduce the risk of developing diabetes, and those who do not have diabetes should have their glucose or blood sugar levels checked each year to monitor for the development of diabetes. If you have diabetes, keeping a good control over your blood sugars with medication, a healthy diet and exercise is important to reduce your risk of heart failure. Cholesterol. Broadly speaking, cholesterol can be split into good cholesterol called HDL and bad cholesterol called LDL. Having high LDL increases your risk of heart disease. To improve our cholesterol levels, there are some things that we can change and other things we can't, such as age, ethnicity and genes. Things we can change include reducing our intake of high saturated and trans fats such as red meat, cheese, pastry and cakes, and keeping as active as possible and maintaining a healthy weight. For some people, making changes to their lifestyle might not be enough to bring their cholesterol down to a healthy level. If this is the case, then we might prescribe a statin or another cholesterol lowering medicine. If you are prescribed a cholesterol lowering medicine, it's still really important to continue to eat healthily, exercise and maintain a healthy weight. Being overweight. Increased body weight may limit a person's ability to perform daily tasks and exercise. Over time, this increases the risk of developing different diseases, including heart failure. A balanced, healthy diet and regular exercise can keep weight under control. Alcohol. Drinking too much alcohol can directly harm the pumping function of the heart. Excess alcohol can also lead to high blood pressure and diabetes through weight gain. Moderation of alcohol intake is therefore advised to help prevent heart failure.